Hey, welcome, and thank you for joining. My name is Trixie Thibodeau, Health Educator for Atlantic Health System. Today's webinar, Aging in Your Own Space, Tips for Seniors on Staying in Your Own Home. And it's being presented by Rebecca Abernante. This webinar is being recorded and will be shared in its entirety on our website. All participants are muted. If you have a question, please use the Q&A button and use the chat feature for comments. We will try to get through all the questions at the end of the presentations. Okay, are you or a loved one interested in smoking cessation? Atlantic Health offers a free quit smoking program. This program includes an individual assessment, free nicotine replacement products, and 6-weekly group meetings to help you quit and stay smoke-free. There are multiple dates and times available, with groups available in person or virtually. For more information about these groups and other resources for additional dates and times, please call 1-844-472-8499. I will also put that in the chat for everyone. Okay, and now we will get started, and I welcome Rebecca.
Thank you very much, Trixie. I'm just going to share my slides. Give me 1 second here, and we'll just open them up. It's so nice to see everyone with us today. I hope that everyone is doing well. Trixie, you can see my slides okay? Oh, you're on mute. Well, thank you, everyone, for your patience. I truly appreciate it. I hope everyone is doing well today, and thank you very much for the opportunity to chat with you. My name is Rebecca Abernante, and I coordinate the Healthy Aging program here at Atlantic Health. Some of your names are familiar, so if we've met before, it's a pleasure to see you virtually again. Today, we're going to be talking about a topic that I think for many of us is something that many of us may be thinking about, but also not quite sure where to even start with this plan. So I'm a social worker by background. I've worked with older adults and their families for about 20 years in a variety of different settings. And, when many times when my older patients will say to me, I really want to stay in my own home, it's important that we think about how do we actually do that? Because it doesn't necessarily happen magically. We have to plan for that. So when we think about long-term planning, I always tell folks that long-term planning is something we have to think about like a triangle. It's a balance between maybe what kind of care we need now, but also in the future. Where do we prefer that care takes place at home versus a community setting? And then financially, what can we afford? Because we know that unfortunately, all long-term care costs are things that we have to pay privately before we might be able to utilize social service programs if we have limited resources. So in my experience, that oftentimes when people want to talk about staying at home, we have to think about if we needed more help than what's available to us at home, how would we get that? Where would we get that? And financially, what can we afford? So we're going to break some of this down a little bit today. So in thinking about this conversation about staying in our home, aging in our own space, wherever we call home, and I use the word home. It doesn't mean a house. It could be an apartment. It could be a condo. It could be something we rent, something we own. Home means wherever that we call ourselves and find home to be. But when we think about this conversation, we're talking about the idea of aging in place. If you've heard that term before, it really just means the ability to stay in wherever we call home for as long as we are able, while being able to get any supports that we might need to help us adapt to our changing needs. As I said before, this is a decision when people say, I want to stay at home. We have to think about this in advance. It's not something that happens magically. It requires a little bit of advanced planning. And oftentimes what happens is that if we haven't pre-planned, that might increase our risk of unintentionally moving to a setting where we didn't necessarily want to be, such as assisted living or a nursing home, something like that. So when we think about aging in our own space, we have to think about the environment of our home, the supports available to us in the community, the resources that we have to utilize to pay for care, and then what are the supports that are available that could help us navigate both our inside our home, but also in our community that we live. right? So let's start to break these down. All right. So I first want to give you a little bit of a picture here. Look, using some of our finder skills, right? There's 14 dangerous things in this picture, right? We're thinking about our home environment. So think for a minute, and if you have any ideas about what you see that might be dangerous, you can go ahead and throw them in the chat. If anybody finds anything that is dangerous, that would be something we want to look at, right? Anything dangerous that anybody sees, you can go ahead and put it in the chat. There's 14 of them. Most people, may be able to find maybe 10 things, but as we kind of get started, the things that we see that are dangerous, right, are things that things that maybe we were obvious, maybe not so obvious. So there's stairs without a handrail. There's a deactivated fire alarm, right, hanging from the ceiling. There's things on a space heater, which that's never a good idea. The outlets seem to be a little bit overloaded. We have extension cords all over the place that might be something we could trip on. If there's smoking, which I know that Trixie mentioned about our quit smoking program, but things left unattended, smoking or something, candles also are something that happen that can be left unattended. The shut off isn't working on the coffee maker. There's open and expired bottles of medication. The rugs are a little bit loose. There's slippers on that this person doesn't have a back on the back of their slippers. There's some things on the stairs which could present a little bit of clutter. The newspapers are a little bit too close to the lamp, which could overheat potentially, and there's no handle or deadbolt on the door. So this is somewhat of a little bit of a goofy way to think about our home environment. But these are things that oftentimes that when you add them up, contribute to our identification of what is safe at home, right? So when we think about our home environment, we have to consider 4 different areas. The first is our ability to get in and out of our home. How easy is it for us to navigate in it, getting in and out? Do we have a lot of stairs? How easily can we move around if we needed to use any assistive equipment? Not now, but thinking about the future, right? How well can we move around inside our home? Do we have easy access to the things in the areas and the rooms that we need to utilize regularly? If you live in a house, for example, that has your bathrooms and bedrooms and everything upstairs and laundry room in the basement, how well would we be able to access those areas? And we have to think about home safety, right? So we started talking a little bit about home safety in the previous picture, but home safety means not just for ourselves, but anybody else in the home, including if you have any pets, right? Are there thinking about safety for them as well? So some common modifications that can be made. We always like to start with our bathroom. And the reason why the bathroom is such a good place to start is because it's the area of opportunity that we have the most opportunity to make improvements to be a little bit safer. Because oftentimes we have tile floor when combined with water, create a little bit of a slippery environment that provide us with opportunities, to try to prevent any falls. So in the bathroom, installing things like grab bars, right? You see the picture in the top right corner there of some grab bars. And the grab bars that are usually recommended are not the suction cup ones. The suction cup ones are fine if we are just using it as a touch point, meaning it's just a little thing for stability. But if we are pulling on it, or we think we might need it in the event that we're slipping and falling, the suction cup ones are not meant to hold an adult person who's pulling on it because they're holding on for dear life. Oftentimes the suction cup ones will fail. So we usually recommend the ones that are a little bit textured, they're metal usually, and drilled into the wall. Those are the safest kind, right? Shower chair. They also make shower benches that if you have a tub shower combination, it's a bench that feet go on either side of the side of the tub, so you can sit down from the outside and slide on in. Handheld shower head, really easy, simple thing to do to help modify our environment, to help improve not only our independence but our safety. Think about in your bathroom, do you have adequate space to move around? In the event that you had to use any type of assistive equipment, even for a short term, reason. Perhaps that you needed to utilize something because you're recovering from a joint replacement surgery. Would you be able to navigate your bathroom? Thinking about our kitchen, moving on, moving things to the places and the shelves and the areas we can access easily. We don't want to be climbing on step ladders to try to reach things that we use on a regular basis. If you have, thinking about your faucets, trying to change the faucets to a touch faucet, changing the handles to a D-shaped knob can be very helpful if we have any arthritis in our hands or we're having changes in our dexterity to be able to grab onto something that makes life a little bit easier. In our common spaces, we always like to remove any throw rugs. Certainly throw rugs, they look lovely, but they are a significant tripping hazard that if we have a lot of, if they always kind of curl up on the sides and present an opportunity to fall. So we like to remove the throw rugs. If you have a landline in your house, consider putting multiple wireless phones throughout the house so that in the event that you needed access to a phone, you'd have easy access to a wireless phone. Oftentimes, many of us are not used to carrying our cell phones with us at all times. Younger people, they carry the cell phone like it's surgically attached. Most of us don't. So if we're not used to carrying a phone with us, to make sure that we have access to help if we need it. If we have stairs wherever we call home, consider that we might need handrails on both sides. Oftentimes what happens that we might have a railing on the way up or on the way down, but not necessarily on both sides, so that if we need to use something on the right going up the stairs, that there's a railing on the right, but there's maybe not one going back down the stairs on the right side. So we might consider more handrails. If we need a stair lift, if we're having changes in our hearing, considering installing doorbells, smoke alarms, things that have a visual alert that can alert us there's something going on we need to pay attention to. So in thinking about our home environment, if we needed to use any equipment, think about how you would get in and out of your home. How would you navigate around inside your home? Certainly outdoor ramps can be helpful. They make you'll see on the picture all the way on the right, the aluminum types of ramps. They do make those that, sometimes we need that depending upon our environment. But sometimes that if you have, just a very low threshold, you can do a little rubberized wedge you sort of see in the picture here, to be able to make it a little bit easier just to get through the threshold of the doorway. Adding lighting can be very helpful. Automatic lights, things that automatically come on when it's dark outside, or motion detecting so that it's a little bit easier in the event that we are not fumbling for a light switch. Maybe we need to install something like a stair lift. You see this here, to make it a little bit easier. Thinking about if you're going into your doorway, do you need a little shelf or a table, somewhere to put packages down? Somewhere to put some, things that you're holding so that we're not doing what I call the doorway shuffle, where we're fumbling for keys and anything that we have in our hands. That increases our risk of a fall, which the name of the game is really trying to prevent any falls. Right, so thinking about if you had to use equipment, if we needed to make modifications, what would that look like in our environment? And so this is often a question that I get is that, well, what do I change? How do I know what might be the best thing for me? It really depends on the individual. There's no correct recipe for everyone because all of us have unique needs. Our environments are unique. If you have ever had physical therapy or occupational therapy at home, you can always ask them to say, hey, looking around my environment, is there anything that based upon my specific needs you might recommend? It really depends on the person. Depending upon what the needs are, we can make some simple fixes like we've talked about, installing grab bars or a handheld shower head, a shower chair, things like that. Some of those things are pretty simple, but depending on the individual needs, some equipment might be needed that involves a little bit more professional installation. If we needed to really renovate a shower or, things like a stair lift, that takes a little bit more expertise. So there are professionals who can help assist with not only identifying what could be helpful, but also be able to provide some guidance that are available. There, certainly there's some companies out there. There's if we need to do any serious home renovation, there's actually certified aging in space specialists who are certified by the National Association of Home Builders that can help really look at things that if we're really talking about major home surgery that needs to be done. But oftentimes that if we're really looking at our environment and saying, you know what, going back to that triangle, balance between our needs and our preferences and our finances, that financially, maybe, doing that significant home surgery may not be something that's possible. So maybe we need to consider transitioning to an independent living environment that has some of these things built in that still keeps us at home, but perhaps in a different setting with some things built in. 55 plus communities in particular have a lot of these aging in place concepts already built into the living space, everything on one level, grab bars, things like that. So really depending upon the individual, that may be something that when we talk about where home is, in aging in our own space, that makes sense as part of a larger plan. All right. So in thinking about the supports that are available to us, not only to help make our home a little bit safer, but also thinking about what supports could be able to assist us at home, we certainly would talk about some of the technology options that are becoming more and more prevalent. So medical alert systems are have been around a very long time. Most of you are familiar with these types of systems, and the old versions of these systems looked very much like the system in the top right corner. Has a big button on it that it's very straightforward. And I think what's interesting is that as these systems have evolved, the older versions really relied very much upon the user to push the button. The button didn't always work if they were outside of the range. Sometimes that, I've had people that have these systems, they're reluctant to push the button or to wear the pendant because it was very obvious as to what it is. But what's interesting is there's a lot of new technology out there. It doesn't have to be a big bulky subsystem like this. They still sell them and they're certainly available. They're often the most cost effective, but there's a lot of new technology that offers a lot more either stylish options, has GPS technology. So if we're on the go, we can get help. A lot of systems also now have motion sensing technology so that in the event that you have a fall, that it can automatically detect that you've had a fall and be able to call for assistance. So, that's helped eliminate some of the challenge that people had. They couldn't press the button because they hit their head and lost consciousness. So a lot of the new systems have fall detection technology. Some of them look like jewelry. The big piece of why I mention this is that especially if you live alone, there's a piece of this that can be helpful to help give some peace of mind to know that in the event that something happened, you would have access to help if you needed it. I always tell folks that it's better to have this and never ever need it than to need it and not have it. It is a private pay service. They are, range from very, limited types of devices that are very simple, that are less expensive to a much more expensive service depending upon how fancy you want to get. If you have Medicaid, not Medicare, Medicaid, they may cover a basic model of this. The other piece when we talk about technology is all the smart home technology that has really come to the forefront, and a lot of the assistive technology that is out there. A lot of the smart devices, I won't say the Amazon or the Google ones because some of you may have these devices. I don't want them going off and think I'm talking to them. But a lot of these devices have add-on technology that can be helpful to modify our environment, to help manage things like temperature, appliances, lighting, cameras, things like that, so that you know who's at the door. They can really be helpful if you're open to this type of technology. Some of the devices are very simple. They can help improve not only our access to information, but also technology, social things. I have one of my patients that at the very beginning of the pandemic that her son bought her an Amazon A device. And every day she asks the A device to tell her a joke. And she then goes and calls her friends and tells them the joke. So, it really depends on how we want to use this. If you're open to it, there's a lot of opportunity in different types of technology that can make life a little bit easier. All right. So thinking about the supports that are available in the community. So I want to kind of move to the other piece of what we think about our plan is what supports could be available to us. I always tell folks that it's best to try to do some homework about what's out there before you actually might need it. We never like to try to make decisions in a crisis. We like to try to avoid that if possible. But so looking at different opportunities of what might be available to you in your community. So looking at many senior centers, sometimes they have classes, they have wellness programs, they also have connection to potentially to volunteers. There's community nonprofit agencies. They may have some supports available to help with low cost maintenance services, maybe some counseling programs, volunteers, bill paying programs, different supports available that can help older adults specifically in the community. Transportation, probably one of the top 5 questions I get often, is thinking about what transportation options. So certainly that, very much in this beautiful garden state that we have, we're often, we do have some public transportation options, but certainly in some parts they are more limited. So in thinking about transportation, in the event that you were not able to drive, what services or supports might be available to you? Most counties across the United States have some type of a senior bus that can be available for medical appointments, grocery shopping, things like that. Every county has one of these. The only caveat is that you have to make an appointment, you have to make a reservation in advance. It is a shared ride transportation that provides curb to curb, so you have to be able to get out to the bus to get on it. But it is an option. It's usually it's very minimal cost or it's a donation based service depending upon what the need is. And usually no one is ever turned away because they can't pay. Thinking about it, also for transportation, I've had some other people utilize something called GoGo Grandparent, which anyone's ever heard of this. It's a telephone based interface for Uber and Lyft, the on demand transportation. It is a private pay service, but for people who don't have a smartphone to be able to access Uber or Lyft, it's a nice other alternative to help access the on-demand types of transportation without having to have a smartphone. So it's called GoGo Grandparents, and that's available nationally. Looking at the faith communities, if you're a member of a faith community, sometimes there's supports available for members. Even if you're not an active member of a community, you might still consider reaching out to say, hey, is there anything available? I'm a senior that lives in the community that could be available to help provide some supports. The other piece outside of transportation that's probably in my top 10 list is about meals and groceries. And oftentimes grocery shopping becomes an area that if people are struggling with, it's often one of the first areas, because if we think about what it takes to be able to go grocery shopping, we have to be able to get to the store, walk around these enormous grocery stores, being able to reach things to put them in and out of the cart, put everything on the conveyor belt. These days you have to make sure you bring your bags with you so that you can package things up, right? And then get everything back into the transportation and get it back home. So outside of the support that families and neighbors and the other people in our lives, which we're going to talk about in a moment, grocery shopping is an area that sometimes people struggle with. So there's certainly stores that you can do online ordering and delivery, that can be helpful. If we needed help with preparing meals and we have difficulty getting out, there is Meals on Wheels that is available to us. Meals on Wheels is a service available in every county across the country. I always tell people that it's not gourmet, right? It is an option. It's not gourmet, but it is a nutritious meal. It's delivered. What I really like about Meals on Wheels is that it's a daily check-in. It's someone knocking on the door, providing a meal, a little bit of a social interaction for a few minutes. And there's a nice opportunity just to make sure that we have the support and the meal that we need. So that is an option. And it's usually a small fee. No one's ever turned away for inability to pay, right? But it's usually for people who are homebound, that we can't get out without the assistance of another person. if we can get out, but we still have difficulty preparing a meal, many senior centers also offer a daytime meal, again, for a minimal fee. That's a nutritious meal. So that's another option to go get a meal, is if we're able to get out to go to the senior center. All right. So and thinking about the supports that are available to us, home care is usually the number one service that people utilize to engage to be able to stay at home. Home care can be anything from a nurse to a home health aide level of professional, physical or occupational therapy, social work support. And there's a couple of different types of home care that we're going to talk about. So home care can be very beneficial to help people recover from an illness or a hospitalization, or if we need ongoing assistance because we have changes in our level of functioning and we need additional support, whether to help us with our personal care needs or to assist us because we have memory changes. And as I said, it's the number one service that people utilize, the formal service, to help us stay at home as opposed to moving into a facility setting. So the reason why I said there's two different types of home care is that there's Medicare and health insurance covered services, and then there's what we call ongoing custodial private care. So Medicare does not cover long-term ongoing custodial care. The only type of home care that Medicare and health insurance covers is very short-term intermittent support when prescribed by a physician, when we meet clinical criteria to help us recover from an illness or hospitalization. It might be a nursing visit once or twice a week, a home health aide for an hour or two once or twice a week, physical therapy a couple of times a week. And it usually doesn't last more than, maybe a month, few weeks, depending on the clinical need. It is not an everyday, all day type of service. Medicare and health insurance will never cover that level of support. So if we need ongoing help for personal care, to help us with our daily activities of daily living, things like bathing, dressing, grooming, getting to the bathroom, we need some additional support because we are living with some functional or memory changes, then that is what we call ongoing custodial private care. That this is not covered by insurance unless we have a special long-term care insurance policy that would cover this. It is not covered by Medicare or other types of health insurance. It's usually private pay, unless we have limited finances and we're eligible for programs like social service programs like Medicaid, which we're going to talk about in a bit. So if we need this type of support, right now, the average cost in the North Jersey area is running about $35 an hour. And most agencies that provide that want a 4 to 6 hour minimum visit with a commitment of about 2 to 3 visits per week, so that you have a little bit of a ballpark of an idea about the cost for that type of care. All right, so moving forward into thinking about our long-term triangle is what type of supports are available. The other piece outside of home care and the supports available in the community oftentimes is the people that are in our social support system, whether that is our family, our spouses, our children, grandchildren, nieces, nephews, neighbors, friends, all of the people we turn to in our day-to-day support system. And oftentimes the support provided by family and friends can be really helpful, because they're sort of our built-in natural helpers, right? But I always encourage people to try to have honest conversations about mutual preferences and the expectations. So the reason I say this is that especially if your plan is you want to age at home and you really want to stay in your own home as long as possible, that it's important to tell the people in your social network that that's your plan. And this is sort of what you've thought about in terms of accomplishing that plan. This is what your thoughts are, because in thinking about this, that not only that that way your support network can help support you in that plan, but if you need them to do any research for you, if you need information about things, that they can help you find some of that information, right? So that in the event that something happened, that you're on the same page as far as what the plan is, right? So that we're not trying to make decisions in a crisis. We really, really want to try to help avoid that. And so trying to have honest conversations about mutual expectations. And I tell the story, years ago, I had a gentleman I was working with that he and his daughters had come in, and they were very well intentioned. The daughters really were well intentioned, but they had noticed that my patient, that he was having a little bit more difficulty in preparing his meals and kind of, making things. He lived in an apartment and trying to help kind of keep him there. And his plan was he wanted to stay in that apartment, but it was becoming more obvious that he needed a little bit more help in staying in the apartment. And his daughters, who again were very well intentioned, said, "You know what? That's it, Dad. You're coming to live with one of us." And he didn't want that. And so, in having that conversation, that he didn't want to leave his apartment. He really wanted to stay there. And how could we really put some supports in place that addressed the legitimate concerns that they had about how well he was doing, but also kept him where he wanted to be? Right. So I always tell families, if it's possible, let's try to work together on a plan to help not only to avoid some crisis decision making, but also that everybody's on the same page if the plan changes or if something does change, right? So one of the ways that we can do this is thinking about the things that we need to get organized, right? So I always tell folks that regardless of how we are able to try to organize information, whether you are someone who likes a file box, you like an accordion file, a file cabinet, you want to scan things and put them into a cloud online drive, whatever works for you, it's helpful to gather this information so that in the event that we need to find it, we're not searching for it in a crisis, right? And making sure that we've told the people in our support network, our close people, and especially where to find things, right? So including all of our medical information, who are our doctors, who are our specialists, what medications do we take, who prescribes what, right? What's our medical history? We're going to talk in a moment about our healthcare documents, but if you have those documents, where are they? Do you have copies of them, copies of your health insurance card? Our legal documents. We're going to also talk about those in a moment as well. Financial accounts and locations. Again, this is not saying that we have to broadcast how much money is in accounts and things like that. But just where are the accounts located? What bank are they still with? Especially if we're hoping that at some point in time, if we needed it, that someone might be able to assist us with applying for social service programs, or if we needed, if we have a durable power of attorney and we would want that person to assist us with finances in the event that we weren't able to manage them ourselves, do they know where our finances are located, right? Any pension information, property deeds, leases, car titles, any copies of our identification, long-term care insurance policies, life insurance policies, all of our important stuff. It can be really helpful to put things together so that in the event that we do need it, that we sort of know where to find it. There's no right or wrong way to organize this. It's just starting to gather this information can be very helpful so that we're not looking for it in a crisis. So speaking about important documents, I'm going to go ahead and assume that everybody that's joining us today is over the age of 18, right? And so because we're all over the age of 18, I'm hopeful that we all have advanced directives, because advanced directives are appropriate for anyone over the age of 18, regardless of our health status. So advanced directives at its core combine two different elements: a living will and the name of our healthcare decision maker. And the reason why these documents are so important is because it tells healthcare providers, in the event that something happened to me medically, not only what kind of care would I want or not want, and who do I trust to help be my voice in the event that someone needed to make some medical decisions for me. So the living will is the part of the directive that outlines the kind of care we want or don't want. And then obviously the healthcare decision maker is the name of, or names, whoever you're choosing, of the person that you want to make medical decisions for you. And these can be ranged from, there's no strict form. It's not something that needs to be completed by an attorney. There's a very basic form that you can, we have one within Atlantic Health. There's a fancy form. The 5 wishes is a good example. There's all kinds of templates for this. Usually most people, if they've done an estate plan with an attorney, you may have an advance directive in that. What I usually encourage is that, just take it out and look at it, make sure it still reflects what your wishes are. And also make sure that whoever you're naming as your healthcare proxy, please make sure that they know that they are your healthcare proxy. Perhaps take a moment and explain to that person why your wishes are the way that you are, the way that you want. I always tell the story that years ago, I had a gentleman that came in to see me and he brought his son with him. And I asked him, do you have these documents? He says, yes. And I said, do you mind if I ask who is your healthcare proxy? And he goes, my son. And he points to his son and his son says, I am. And I always say that we want to make sure we have that conversation before, we don't want to be in a position where, we're looking at, our loved one and saying, I'm looking at his son saying, your dad's healthcare proxy. And he says, I had no idea. Right. So make sure you've told whoever you're choosing that they are that person for you, and perhaps give them a little bit of an explanation. There's a great website called the Conversation Project that offers a lot of templates about how to start this conversation if you don't have this document prepared. The other document that we really talk about as being important, and I always tell folks, I'm not an attorney, I'm a social worker, but I've also worked with a lot of elder law attorneys. And when we talk about important documents, this one is really key. A power of attorney is a legal document. It is different than healthcare directives, but it's a legal document that outlines in the event that I lose the ability to manage my legal issues, financial issues, that I am naming someone who is authorized to do that for me. This is an authority and a power. It's power of attorney, a power that must be given to another person. It doesn't automatically transfer between spouses or adult children or other people in our lives. We have to give this power, right? If you've, again, prepared estate documents, you've likely done this document. Just to make sure, you should take this out every few years, make sure that who's listed is still the right person. Sometimes I've had people that prepared documents a long time ago. They named their spouse. Their spouse is either not able to act in that capacity any longer, or they've unfortunately passed. So make sure that, those documents are updated regularly to reflect, usually most attorneys recommend just reviewing it every 5 years, or if there's been a change. The reason why this power of attorney document is so important, sometimes it's also called a durable power of attorney, is that in the event that something happens and we have not completed this document and we lose the ability to complete it, we lose capacity, then unfortunately that we have to go through a court process called guardianship. Whereby this is, again, it's a court process, it's a legal process, where then a judge appoints who can be responsible to make all of our legal and financial decisions for us. And in fact, most often a guardian is now responsible for everything for us. Unfortunately, I've had this happen where, someone unfortunately is diagnosed with dementia or Alzheimer's disease, some type of illness that's causing cognitive impairment. They didn't complete this document before they lost capacity to execute this document. And unfortunately, even though their spouse was willing and able and wanting to do this, that they had to go to court, and then the judge decides who can make decisions for them. So I always tell folks that this is a very straightforward document. You can do it with an attorney. You can do it on LegalZoom and other places like that. I usually recommend an attorney just because these documents are complex. But you can do this. It's also far less expensive to do this with an attorney as opposed to going to court through guardianship. In New Jersey, the average cost of a power of attorney is under $1,500. The average cost of guardianship is between $8,000 and $10,000. All right. So if you've done this document, great. But again, thinking about what your plan, just make sure you have all your important documents. All right, one of the last pieces of our conversation today is the financial part, right? And thinking about our triangle, we have to think about how do we finance our care. As I mentioned before, that unfortunately Medicare and Medicare supplemental health insurance plans do not pay for long-term care. The majority of costs are something that come out of our own pocket. We privately pay. If we are looking for additional resources to pay for care, if you have a long-term care insurance policy, Make sure that you've taken it out to look at it and see what it covers. Some policies only cover care in a facility setting. So if the plan is to stay at home, then that could be a little bit of a challenge if the policy only covers care in the facility. So make sure you know what your policy covers. Make sure you also know, if you have one of these, what it takes to start to utilizing the policy. What are the requirements that are needed? If we have more limited resources, looking at social service programs like Medicaid, which we're going to talk about in a moment. And then if we're a veteran or the spouse or a widow of a veteran, there's a special benefit called the Veterans Aid and Attention pension benefit. It's a cash pension that's available to qualified veterans or spouses or widows of a veteran to be able to, it's a cash pension that can help offset the out-of-pocket cost of care. So you would apply through the VA for that. I will tell you, it can be a great pension. It can be a great benefit for qualified veterans and their spouses or widows. But it's not a quick fix of a policy. Usually right now, I'm hearing, the last I heard is it's taking about 11 to 12 months to be qualified for that benefit. So things are a little bit backed up at the VA. So just, again, it's an option potentially, but it's not something that happens overnight. All right, so I always tell folks that in thinking about, our costs of care, I think it's helpful to kind of put some numbers out there, because again, we have to be thinking about, in the event that, what my needs are, thinking about that triangle and what kind of resources do I have to better understand the cost. So much like everything else here in our beautiful Garden State, as I said before, we are a little bit more expensive here too for long-term care, which I don't think would be surprising to anybody who's with us today. As I said, the average cost of home care is about $35 an hour. An adult day program, which I know I haven't mentioned, but adult day centers are places that people can go during the day. They're designed for people who are living with some degree of memory change, that offers the opportunity for socialization, recreation activities, and supervision throughout the day. They allow them to then return home at night. So the average cost of an adult day center is about $95 a day here. An assisted living runs about $6,500 per month, and a nursing home is running about $400 per day. So in thinking about these costs, thinking at, again, our finances and what does our plan look like. I've had a lot of times where, sometimes people say, my plan is I want to stay at home, but their majority of their asset is, their assets are tied up into the value of their home. And so if we are not able to tap into the liquidity of that home and that equity to be able to pay for a home health aid, then maybe being at home may not be our trajectory. Because we might need to sell that asset in order to pay for care. Okay. So I did just mention briefly about long-term care insurance. If you have it, wonderful, hold on to it. It can be very beneficial. Usually it's not something that people purchase, later in life. There's usually something that you bought into years ago. Usually most of the policies that are out there that you need to need assistance with 2 to 3 activities of daily living, which are things like bathing, getting dressed, using the bathroom, transfers, not things like meal preparation or laundry. It's really about our hands-on personal care. So for them to start, utilizing the policy, you really need to not only need, you really need some help physically. Okay. All right, and through our veterans pension, as I said, it's a cash pension that can help for wartime vets. Generally, we need to qualify for this by needing assistance with our activities of daily living, which I mentioned before, or that the person lives in a facility. The veteran had to have served 90 days of active service with a minimum of 1 day served during a time of war. And there's certain wartime periods that the VA has. Doesn't necessarily mean that the individual saw combat, but there's also some income and net worth limitations. The VA does look back for 3 years upon application to ensure that the person has money and that they didn't just gift it away and give it away. Oftentimes what we found is that if someone is trying to stay at home, typically the VA pension might be a good option to try to stay at home, or to pay for assisted living because it's counted as income. And that can be very helpful. Whereas if we are already have limited resources and we're paying for care in a nursing home, that typically Medicaid might be a better option. But like I said, it really depends upon the individual. Sometimes people work with elder law attorneys to apply for this benefit. You can also work directly with the VA for it. But certainly everybody's a little bit different. But there's more information on the VA website about eligibility for this pension. All right, so I do want to talk briefly about Medicaid, right? So Medicaid, different than Medicare. Why they name them similar things, I will never know. It confuses everybody. I'll give you my little mnemonic device. Medicare is like care, like health care, because it's our federal health insurance, mostly for people over 65. And Medicaid is like aid, like financial aid, because we have to financially qualify for it. So there's many different types of Medicaid programs here in New Jersey. The one that we talk about most often for ongoing care is what we call Medicaid Long-Term Services and Supports, or MLTSS. And MLTSS, for people who are eligible, will pay for some help at home, pay for some care in an assisted living or in a nursing home setting. Some facilities, usually assisted living, requires that an individual has a certain amount of private funds to privately pay before they might accept Medicaid as a payment source. So for example, most assisted living requires that you have 18 to 24 months of private pay before they might accept Medicaid. The person is Medicaid eligible. So to be eligible for Medicaid in New Jersey, this type of Medicaid, there's other types of Medicaid, but this program in particular, we have to have very limited income and assets. So in 2023, our maximum monthly income for an individual person is about $2,700 per month, and we can't have more than $2,000 in liquid assets. Now, if we have less than $2,000 in liquid assets, and liquid assets is pretty much anything that can be liquidated, stocks, bonds, savings accounts, retirement accounts. If we have jewel collections or art collections, those need to be liquidated. Pretty much anything that needs to be liquidated. If the plan is to receive Medicaid benefits at home, the primary residence that the person is living in can be excluded from the asset component of that. However, that if the individual is receiving Medicaid benefits at home and then they need more care than what can be provided at home, and they would need to move to a facility setting, sell the home, utilize the assets, they would be kicked off Medicaid because now they have more than $2,000 in assets, spend down their assets in that facility setting, and then once they're at the $2,000 threshold again, they resell it. They would reapply to be eligible for Medicaid. The other piece of that is if the person is at home receiving Medicaid benefits and they unfortunately pass, New Jersey is, like many states, what we call a restitution state, which means the state of New Jersey can file a restitution claim after the beneficiary's passing to be reimbursed for the cost of care. Right. For Medicaid, if our income, let's say we have less than $2,000 in assets, but our income is $3,000 a month and it'll exceed that $2,700 income threshold. New Jersey has a special kind of workaround. It's called a qualified income trust. It's essentially, in very simple layman's terms, it's a special type of account where we can divert the extra and the excess that still needs to be paid every month and utilized towards the person's care, but it helps make them eligible for Medicaid. If we are part of a couple, there's a financial assessment. There are spousal allowances to help prevent destitution of a spouse. I believe in 2023, I think spouses are able to keep 50% of the shared assets up to about $140,000, I believe. But there are workarounds so that spouses aren't completely left with nothing, right? In applying for Medicaid, there is a 5-year look back period. They review all financial transactions, assets, transfers. If they find any unaccounted gifting or funding, let's say that we sold our house to our adult child and for less than market value, or we gifted our grandchild money to pay off their student loans, that's considered a gift and could potentially incur a Medicaid penalty period. In 2023, I think it's The ballpark figure is that about for every $10,000 that was gifted, a 1 month penalty period applies. So if we inadvertently gave away $20,000 and we would have been eligible for Medicaid, let's say on May 1st, with the $20,000, 2 months of a penalty period, then we're not eligible for Medicaid to start paying for our care until July 1st. Okay. The other piece with Medicaid is that Medicaid never provides 24/7 care at home. So in the event that we need that level of support, it may not be possible to remain at home. The only place where Medicaid will pay for 24/7 care is in a nursing care facility. Okay. All right, the other two programs that I want to briefly mention, and then we'll take some time for questions, is the other two social service programs outside of Medicaid have a little bit of a higher income and asset threshold. And they're mostly a cost share type of program. Jersey Assistance for Community Caregiving, and Alzheimer's Adult Day Services program. It's a cost share program that helps offset the out-of-pocket cost of care. I've given you the income and asset guidelines here. To apply for Medicaid or any of these programs, you would contact your local county area agency on aging. Some counties call it an office on aging, department on aging. Every county across the country has one of these offices and can certainly be very helpful. So my final thoughts for you are that I always tell folks that when we think about aging in our own space, we have to think about safety, right? That's sort of our bottom line. As we think about our triangle of balancing our needs, our preferences, and our finances, everybody's plan might look a little bit different. And for whatever reason, if our needs could not be met at home due to our medical issues, our health issues, our environment, then maybe staying at home may not be the safest plan. So I always encourage people to think about contingency plans. In the event that for whatever reason we weren't able to stay at home, what would be our backup plan, right? We have plan A. Plan A is we want to stay at home. What's plan B, plan C, plan D? Not the parts of Medicare, plan B, plan C, but what's our backup plan, right? Thinking about our contingency plan. There's a great template from the National Aging in Place Council called the website ageinplace.org. They offer a free downloadable template that helps you sort of think about your own plan. It's a great tool. You can download the template for free. So this is a great place to kind of get started and thinking about your plan. I know Trixie, I'm also going to be sending out the slides to Trixie, so she'll send it out to everyone. So there's no quiz here. You can, you'll have all this information available to you. There's some great resources here available locally. Before we go to questions, I'll give you my 2-minute, less than that, 1-minute elevator speech about who I am, if I can ever be a resource for you. So as I mentioned before, I run the Healthy Aging program here at Atlantic Health, which at its heart is a phone and email resource for people to reach out and ask questions about services in the community, questions about resources. When you reach out, call the hotline, you get me, I'm the hotline, we've met, so there's no mystery about who you're reaching out to. And oftentimes I have people that just say, you know what, I'm just not even sure where to start. And what to do. I also work in our geriatric assessment center practice, which I see patients who are part of our practice. In our practice, which is located in Morristown, we see patients for evaluations or consultative assessments, as well as ongoing primary care. We operate very much like a traditional doctor's office. We just all specialize in working with people over the age of 65. We also have, if you find yourself as a caregiver, that we have our training lab located in Morristown that offers people the opportunity to work with Jerry. That's Jerry, our mannequin. We built Jerry an apartment that's a model home environment for older adults. You can schedule time to meet with myself and a home health aide to actually learn hands-on skills that if you find yourself caring for a loved one, to learn some hands-on training, get some skills to feel more confident in providing hands-on care. In our area, we also have, as I mentioned before, our Medicare covered home care services. We have our Atlantic Visiting Nurse that provides support throughout the region. They also have our Atlantic Adult Day Center, which is located in Basking Ridge. And so with that, that's my contact information that you can feel free to reach out to me. That's my direct number, my email, whatever works for you. That's how you reach me on the hotline if you do have questions. And I know in our last few minutes that there are some questions. So with that, We'll turn it over to questions.
Okay. All right. Thank you for joining us. We kindly ask that you take a few minutes after today's webinar to complete the survey. The link to the survey has been also added to your chat area. A special thank you to Rebecca for dedicating your time and expertise today. If you have any additional questions or comments, you can send us an email to communityhealth@atlantichealth.org, or you can give us a call at 1-844-472-8499, which I've also put in the chat. And thank you. And this concludes our webinar. Have a great day, everyone.
Have a good day. Thank you, Trixie.